My name is Mahra Rainieri, and this will be a presentation about feeding and swallowing in children with Charge syndrome. So before we begin the presentation, I would like to share a little bit about myself. So again, my name is Mahra Rainieri. I am a certified speech language pathologist by the American Speech Language Hearing Association. I am also an international board certified lactation consultant. So I am certified to support breastfeeding mothers. And I attended Boston University where I received my bachelor's degree in speech language and hearing sciences and then my master's degree in speech language pathology. I'm currently a clinical professor at the College of New Jersey. And I also work part-time to provide virtual speech, language, and feeding therapy for a company called Expressible, which is also based in the United States. I have over 4 years of clinical experience with the evaluation and treatment of pediatric and feeding and swallowing disorders, especially in medically complex children. So children that do have genetic syndromes or who have potentially had medical events happen to them young in life. So the goals of this presentation are to establish the why first. I would like us to discuss why this topic is important. And then I would like to teach everyone about normal feeding and swallowing. What really happens when we eat and when we swallow. And this is in people who do not have any difficulty. So I'd like us to first understand how normal feeding and swallowing works so that we can better understand the problems that can arise, specifically in children with Charge syndrome. We will review various feeding and swallowing difficulties in children with Charge that are common. Some of them are congenital or problems that the children are born with. There are difficulties related to oral motor skills, sensory integration, swallowing difficulty, actually having a hard time getting the food into the stomach, issues like reflux and constipation, oral defensiveness, and breathing. Breathing is so important and has to be coordinated with swallowing in order for it to happen effectively. So we will go more into detail about what all of those mean. We will also discuss the importance and impact of tube feeding. Many children with Charge syndrome especially rely on feeding tubes. Feeding tubes can be life-saving, but they also can cause some issues. So I want to discuss both sides of tube feeding. And last, I'd like to explain what feeding therapy is, how it can help, and what your role as caregivers and parents are in the progress that children can make in feeding therapy. So let's start with our why. Why are we talking about this topic? Reason number one, feeding is directly related to growth. And we know that in order for a child to grow and develop, they must get enough nutrients so that they have enough energy. We say children need to gain and grow. That means that they need to gain weight and grow in height. We often make jokes as adults that we are trying to not gain weight, but it is different for children. Children are supposed to gain weight and continue to grow until a certain age. When children are not gaining weight and growing in height at a rate that they should be, they may be diagnosed as failure to thrive. And that means that they are below the 3rd percentile in weight for their age. So this is something that is ideally avoided. We do not want to get to the point where a child is failure to thrive, although when there is a lot of medical events happening to the child, when they may have some medically complex needs, often they may be failure to thrive, and it is the work of the medical team and the therapists to help them gain weight and grow. Reason number 2, food and culture are linked. We connect with each other during mealtimes, and food represents our culture and our families. Because of this, we want our children to participate in family mealtimes. Sometimes this is more challenging when children have eating and swallowing issues. So this is a very important topic because it's not just about the skill of eating, it's about participating in cultural gatherings, being around family, and enjoying food. Reason number 3, I want you all to have a better understanding about what feeding and swallowing is, and then what can sometimes go wrong, especially for children with complex medical needs. So here we have a picture of a child with CHARGE syndrome. And I want you to understand your children, if your child has CHARGE, and how that might impact their feeding and swallowing. Every child is different, but there are some common problems that we see in CHARGE syndrome. I also want you to understand that there are services and resources that can help you, that can help your children with their feeding and swallowing skills so that they can gain weight, grow, and thrive, and participate in family meal times in the way that is safest and best for them. I want to empower you all to have knowledge about this topic and know that your role is so important in your children's growth. All right, so let's talk about normal feeding and swallowing. What really happens when we eat normally? Normally, when we eat, the food goes in our mouth and it travels down our throat to the stomach. We do not want the food to travel down another pipe to the lungs. That can be dangerous. So let's talk in more detail what happens when we eat during normal feeding and swallowing. There are lots of different steps to this process. So step 1 is called the oral phase. Here we see a giraffe, and the giraffe is chewing. So that is part of the oral phase if chewing is needed. Oral means mouth. So this is the phase of swallowing that happens in our mouth. This is when we have something enter the mouth. That could be liquid, like water, or food. And it could also be saliva, what our mouth makes on its own. Any of those things are called a bolus. Okay, so in the oral phase, you have a bolus in the mouth. It could be saliva or drool, liquid or food. The job of the oral phase is to make sure that that bolus in the mouth can be safely swallowed. So if it is liquid or if it is a puree texture, like a thick, not liquid, but not solid, right? Puree might be something like applesauce or mashed potatoes or polenta. Those can be more like puree textures. Sometimes we just have to hold that in our mouth and then swallow it, right? So the oral phase for liquids or purees might be just holding it in the right spot before we swallow it down. If we have some type of food that is a soft texture, then we might need to mash it. We might need to use our jaw and our tongue and move it up and down to mash it, but we don't really need to chew it to the same extent like a solid food. Some foods require a lot more breaking down in order to be safely swallowed. So the oral phase might involve chewing, like this giraffe is doing, and it might involve grinding, like it looks like this giraffe is doing too. So for chewy food like meats, we have to not just chew it, but really grind it down so that it can be safely swallowed. And it also involves, once the food is all chewed up, we need to collect it in the mouth. We need to organize it, right? So that it can be in one place to be safely swallowed. So just at the oral phase, there's a lot of different steps that might be involved depending on if it is liquid, saliva, food, and what texture that food is. If it is something chewy like meat, we have to work on it a lot longer, collect it so that it can be safely swallowed. So the oral phase is what happens in the mouth in normal swallowing, and it is before anything is swallowed. This is something we have control over. We can put something in our mouth, and then we can spit it out, or we can collect it, or we can chew it. This is something we have control over, which is different than the stages that come next. Okay, so the oral phase requires certain skills to move our mouth, to hold things, to collect them, and we have control over how this works. So this is part 1. We prepare the food to be safely swallowed. In part 2, that is called the pharyngeal phase. The pharynx is another word for the throat. The throat is like the path that connects the mouth and the stomach. So in this video here, you see this bolus traveling from the mouth down into the throat space. We're making sure it's going down the right tube, which leads to the stomach. That is the pharyngeal phase. The pharyngeal phase starts right here in this video. So the pharyngeal phase is when the swallow reflex is triggered. This becomes more of a reflex, more of an automatic thing that we don't have control over. So during this phase, the bolus is directed down our throat, also known as our pharynx, away from our nose and away from our windpipe, also known as our trachea. That's the tube in the front that we need for breathing. So we don't want food going up into our nose because we breathe out of our nose. We also don't want food going down our windpipe because we need that to breathe. The job of the pharyngeal phase is to move the food down the throat in the right direction. We don't have control anymore. Once we trigger that swallow, everything at that point, we just don't have control over anymore, unless we have a feeling that it's going in the wrong direction, and then we might cough or clear our throat to try to move it away. But once we actually swallow, it is more of a reflex. Like I said, if food accidentally goes towards our windpipe, we cough. Our body wants it out. It is dangerous for food to travel into our lungs because we can choke, it can get stuck there, cut off our air, or it might not get stuck, but it will land in the lungs where we can then get sick. We can get pneumonia if that happens too often because the food will sit in our lungs and bacteria will grow, and that may cause illness, which can be severe and dangerous. So this is the pharyngeal phase, getting the food to the stomach safely. Part 3 is known as the esophageal phase, when the food travels down the lower part of our throat, called the esophagus. And then as you can see at the very end of this animation, the food is about to enter the stomach. Okay, so the esophageal phase is happening here, and it ends when the food enters that stomach at the bottom. So the bolus moves down the throat into our esophagus, which is a tube that leads into the stomach. The food enters our stomach, and then we were successful. We swallowed our food and it got to the right place. So now the swallowing stages are over. And you can see in this video that this bolus is traveling down, 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 and then it is reaching the stomach where there is stomach acid to help break down that bolus of food or liquid or saliva. I like to think about swallowing like a series of tubes and valves. So we have all of these open tubes in our mouth, our throat, going down to our stomach. And when we close off certain valves along the way, as the food travels down, that helps push it in the right direction. So the first valve that we have when we swallow is our lips. We put food in our mouth, we prepare it to be swallowed during the oral phase, and then we have to close our lips as the first valve to build up pressure and help push that food down towards the stomach. When we swallow and trigger that swallow reflex, the back of our tongue touches our throat, closing off space and creating another valve to drive pressure in the right direction. We'll talk about this more when we think about how feeding and swallowing is affected by CHARGE syndrome. But one of the big issues in having disordered swallowing, especially in children with CHARGE, is because of weakness, we may not be able to close off valves in the right spot so that we can move things in the right direction. What you can see here is in this video, when the valve is closed off, it prevents the water from flowing in a backwards direction. This is like swallowing, where if we do not close off one of the valves along the way, then things might move in the wrong direction. They might go into our lungs instead of down our throat, or we might have food coming out of the mouth, leaving the lips because the valve at the lips is not closed. So this is a way to think about how swallowing is similar to a series of tubes and valves. And when these valves are not working properly, we can have issues and difficulty. Another way of thinking about this is that the bolus is going to follow, going from areas of high pressure to low pressure. And I like to use this down facing arrow as a way to remind us that when we put food in our mouth, we want everything to travel down. We don't want it to come back up. So when we have closure at a valve, and that could be from something closing off or muscles squeezing, right? We need strong enough muscles in our face, in our throat to squeeze to help move that food and increase pressure at certain points so that it can travel in the right direction. When a valve closes, that increases pressure. We need that pressure because that is what helps move the food down in the right way. Okay, so we have valves that close, like the lips, like the tongue touching the back of the throat. The top of our throat moves up a little bit as well, and that helps to move our windpipe out of the way. And all of these potential valves, if they are not closing properly, if they are not closing strong enough, or if they are not closing at the right time, then we get dysphagia, which is a swallowing disorder. Our throat muscle squeezing also creates important valves along the way. We want the food to go down, not come back up. The last really important thing that we need to review is how important it is to always make sure that breathing is being addressed. So normal swallowing means that we can control our breathing too. When we swallow, when we actually trigger that swallow, there is a moment where we hold our breath. This is to protect us so that we close off our airway, our windpipe, and prevent food from traveling below a certain point and into our lungs. Our bodies will always make breathing the biggest priority. We know that eating is important. We know that it is important to get nutrients and calories to gain weight and grow. But if you're not breathing, you're not alive at all. Feeding and swallowing can wait. So breathing is the body's #1 priority. You will hear me repeat that a lot during this presentation because if we do not have good breathing coordination, then swallowing is most likely going to be impacted. So our bodies will always prioritize breathing, and we need to be able to have breathing and swallowing working together in order to be the most functional and safe. One way where we can have a better chance to coordinate breathing and swallowing is to make sure that we are positioned correctly. This is why we don't lay down and drink water, right? We probably could, but it's not as safe. It's way more likely that the water is maybe going to end up going down the wrong way, right? If we are laying down. We want to put ourselves in a good, safe position so that those valves and tubes can function as best as possible and that we aren't trying to make it harder than it needs to be. This is really important, especially for kids with charge syndrome or kids that have more medical needs, because getting them in the right position can sometimes be challenging. So this is an important thing that we don't want to overlook, and we'll talk more about this later. Breathing is the most important thing. Breathing has to be coordinated with swallowing, and the position that our body is in can either make that breathing easier or harder. So another reminder, the body's #1 priority is breathing at all times. Eating is not the most important thing. Breathing is. So now that we know what happens when we eat and swallow normally, let's talk about how this can be harder for children with charge syndrome. Let's talk about some of the common feeding and swallowing problems. these are common problems, but that does not mean that every child with charge will have these problems. Some children may have some of these problems and not others. Some children may have all of these problems, and some may not really have these problems at all. So these are just common problems that may or may not relate to your child. When we have swallowing